If you've ever had a day where it feels like every joint in your body hurts, at the same time, your knees, your hands, your shoulders, you're probably wondering, what's going on? Is this aging? Is it arthritis? Is it inflammation? Or is something more serious going on? As a rheumatologist, this is one of the most common and most confusing complaints I hear. And even if you already have an autoimmune condition like rheumatoid arthritis or something else, this still applies to you because not every episode of joint pain is automatically a flare. When one joint hurts, it's often mechanical. But when multiple joints hurt at once, the pattern tells us something. There are 6 common reasons why this happens. Some are temporary, some are lifestyle related, and one of them is the one I pay the closest attention to because catching it early can change everything. I'm Dr. Neha, let's dive in. The first cause that I think about is the immune system in attack mode. Not because you have an autoimmune disease, but because your immune system is reacting to something. I recently saw a healthy adult who had a sore throat, took antibiotics, and thought he was improving, at least in terms of the throat. 4 days later, while he was at work, his knees and ankles became so tender, painful, swollen that he couldn't walk. They had to get a wheelchair for him, and he's another doctor that I know, and he was on rounds at the hospital and he just couldn't continue anymore. That's how dramatic immune activation can be. He did take anti-inflammatories for a few days, and actually his pain went down slowly and is completely gone now. What likely happened wasn't chronic arthritis. It was a temporary inflammatory response from his body because when your immune system is fighting an infection, it releases inflammatory chemicals called cytokines. And they don't like to stay in just one place. Sometimes they like to circulate. Timing matters here. If your joint pain began days to weeks after an illness, this is something that we think about, post-infectious arthritis or post-infectious joint pain. But if you haven't been sick recently, this probably isn't your cause. So let's move on. The second cause is mechanical overload. And this one surprises people, especially those who already have an autoimmune disease. But the problem is anyone can get anything. I have a patient who's well controlled with rheumatoid arthritis on biologic medications. Day-to-day activities are usually fine. Nothing really holds him back. But he's doing a backyard renovation. He's digging, he's lifting, he's carrying heavy materials. And within days, his joints really started hurting. All over the place, places he's never had pain before. He assumed it was a flare. But when we looked at the pattern, there was no prolonged morning stiffness, no new inflammatory swelling pattern, just stress that's multiplied across multiple joints. And at baseline, he already has this condition, so maybe it's easier for him to have more pain. If you don't have an autoimmune disease, you can still develop all this pain from just overloading your joints. For my patient, I did not change his medication. I told him to get help finishing his backyard. That would probably be the most effective thing to do in his situation. And it helped. His pain went down when that strain stopped. Sometimes your joints aren't inflamed, they're overwhelmed. Mechanical pain usually gets worse with activity, improves with rest, has just a little bit of morning stiffness, not like hours like you can in an autoimmune disease. And also, it does not cause dramatic swelling in your joints. That distinction matters because a lot of people mislabel joint overload as inflammation. The third cause is osteoarthritis, what most people call wear and tear. As we age, cartilage gradually thins, the shock absorption decreases. And because aging affects the entire body, you can develop osteoarthritis in multiple joints at the same time. Common areas are hands, knees, hips, spine. Osteoarthritis or stiffness in your joints in the morning is usually not too long if you have osteoarthritis, often less than 30 minutes. And pain generally gets worse the more you overuse things. It improves with rest. It can affect several different joints. A lot of times people have some worse areas. Like if you really try to drill it down, they may say, okay, it's a little bit worse over here. That's maybe my worst spot. Or the spine. They're not usually all at equal levels. Usually you will not see dramatic swelling across multiple joints. If your stiffness lasts longer than an hour in the morning, that's when I start thinking differently. And we'll get back to that in just a bit. But cause number 4 is muscle loss. Starting in our 40s, we naturally lose muscle mass every decade, unless we're actively training to maintain it. Muscle stabilizes joints, and when muscle declines, the joints absorb more force. Tendons will compensate for that force, and the small imbalances in your body will spread. Patients often say, everything feels sore. My joints don't feel supported. There may not be any swelling, there may not be clear inflammation, but multiple joints can ache at the same time. This is one reason that strength training can be so powerful. or your joint health. It's not cosmetic, it's protective. The fifth cause is hormonal and metabolic shifts. In midlife, especially for women, estrogen levels change, and estrogen does affect immune regulation. This is all data that's coming out. We didn't know this as well before, but it's the more recent data that is showing this, and there is more and more data coming out on it. Estrogen affects immune regulation. When it declines, the inflammatory signaling can increase. And at the same time, when you have an increase in visceral fat, which we're all trying to avoid, but it can happen, that can raise the baseline inflammation in the body. You don't necessarily feel sick, but your joints feel different, more diffuse, more persistent, harder to pinpoint. And now we're moving into that final cause, the one that changes how we evaluate everything. The sixth cause is autoimmune arthritis. This is when the immune system doesn't just activate temporarily, like we talked about in the first one, where you had an infection, your immune system went haywire, and then it calmed down eventually. In this one, it keeps going. And instead of attacking a virus, it's attacking your joints. The pattern is what makes this different. Symmetry, both wrists, both knees, both ankles, both feet. And that's just for rheumatoid arthritis. You're allowed to have other types like psoriatic arthritis, which is more asymmetrical. It can hit the same areas actually, but also tendons and ligaments and your spine. Or ankylosing spondylitis, also possible. We have a whole host of autoimmune conditions that can cause arthritis. Some of the common things we look for is prolonged stiffness in your joints. So when you get up in the morning, were you able to just jump out of bed? Or do you feel really stiff, very old? How long do you feel like that for? If it's just a few minutes, that might not be as concerning for autoimmune flares. But if it's more than an hour, certainly it's something that you want to talk to a rheumatologist about. You can see visible swelling. You can see fatigue that's not really matching the amount of activity you're doing. And here's something important. Early on, the blood test can still look normal. That's why pattern recognition matters more even than lab work, especially at the beginning. The good news though, is when it's caught early, autoimmune arthritis is very treatable. The key is recognizing the pattern, not ignoring it. And just one more thing, if you're having pain all over your body and you feel like it's in your joints, but you have lost a lot of weight, or you're sweating in the middle of the night and all of this is new, you also want to look at different causes like cancer, because they can present in different ways. So certainly if it's something that's the whole body's being affected, go in, get evaluated, because you don't want to miss something like that. So if all your joints hurt, it doesn't automatically mean that you have something serious, but it also doesn't mean that you should ignore it. Timing matters, pattern matters, context matters. And if you want to learn more about how to tell apart inflammatory arthritis apart from normal aging, I have it linked here. Because the more clearly you understand the pattern, the quicker you can get treatment. I hope this helped you. Share with somebody else who needs this. And I'll see you next time, Dr. Neha with Plant Forward MD.